Hi, this is Delegate Montgomery, District 14, Maryland, and this has been quite a ride this session. It was, of course, driven by lack of funding. As anybody out there watching knows, there's not a whole lot of money and there are a whole lot of needs. But what we tried to do was keep the budget so that the people who needed help the most got it, and tried to, unfortunately, take a lot of money from things that we would all have preferred funding fully. One of the committee things that I'm on health and government operations, and government operations does indeed deal with small and minority business. We did our very best to encourage them to apply. We've made it electronic now. We've tried to make it less complicated, and we want all those small businesses out there to start to apply for low interest loans, to get them and to get up and running and hiring employees. So I hope you will follow through with that. We can make sure you get that information if you call into my office. Now, one of the other things that we do deal with is electronic access to public records. This has been something that's bothered people this year, and due to Delegate Carr, to my committee, to a number of us, we have made it easier for groups that are interested in what does happen in public meetings to access that information. And we're proud we got that through. We do believe very much in open government, and I think we're getting there. We're succeeding. One of the other issues that I did talk about was the fact that Maryland had a very high rate of home foreclosure due to medical hospital bills. So for people who do qualify, and they're people who generally are below 500% of their, below the 500% poverty rate, those folks will get some reduced fees. They also need to be told when they enter a hospital, or the person looking after them, that there are a number of ways to get some help and to access it. And we do hope that this will keep the foreclosure rate on people's homes down. We also made the hospitals available that they can, if they need to, they can put a lien on the house. But this doesn't mean anything to the homeowner until they sell the house, at which time the hospital then could get the money. But this will keep, we hope, some of the many, many foreclosures due to hospitals down. And I did sponsor a bill to protect the environment and save homeowners money. And it's a clothesline bill. It says homeowners association, condo associations will be able to make rules to hang clothes outside. Now this will save the average family about $150 a year. At the same time, save energy, and at the same time, frankly, I think sheets and towels dried out on the line make a very pleasant and fresh smelling in the bathrooms and bedrooms. So I don't know whether that bill is going to get through. There's still a fight going on about it. There is also discussion going on about a concussion bill that's in the House and the Senate, and it does protect the kids who are playing sports from being sent into a game again after they've had a concussion. Without this serious double concussion, one after the other, can lead to permanent damage and has on occasion led to death. So we'll be promoting the signs of concussion. They should be promoted to all of the sports teams in schools, even if this bill doesn't get out quite the way I wanted it to. As we also noted that the developmental disabilities, and many of you do know I have a son with autism, developmental disabilities is getting a review. We're trying to tie some of the fees that these organizations that look after the kids and young people and even older people who need the help the most, that their wages are associated and their organizations with the cost of living. They have been seriously underfunded, and we hope this helps. Additionally, some people whose condition has worsened, they can appeal and be notified if they have indeed lost their appeal, and can go back and try to get more support as needed. I would like to add, before I close out this section, that when a session, as this one has been, is driven by lack of funds, many very good bills, out of necessity because of their lack of funding, have had to be, shall we say, lessened in their impact. In many cases, this is very regrettable, and I certainly do regret it, because what has happened is a bill doesn't do what we really intended it to do. But as in every household, when money is short, you have to do cutbacks that you may not like, and we have done that. I am sorry, it's necessary, but what we've got to do is get America working. We've got to get the working people earning a good wage so they can support their families. And I do hope that you all will continue to be in touch. This is Delegate Montgomery, District 14. Thank you.